Hi, I'm student Dr. James Utley. I'm studying at Southern California University of Health Sciences. Today we're going to talk about cranial nerve exercises. So we'll just jump right into it. So the first cranial nerve is your olfactory nerve, which is responsible for smell. This can probably be best exercised using aromatherapy, so using like essential oils or something. I have a vapor inhaler, probably not the best aromatherapy, but you can just do one clogged nose and just inhale. One clogged nose and just inhale. And you can do that with like your favorite essential oil or something, and that'll help activate your olfactory nerve and stimulate your sense of smell. And actually like help relax you a little bit too. Optic nerve is sight, and we're going to do this through the Brock string, and we'll demonstrate that later. This is also going to be oculomotor, trochlear, and abducens nerve as well, which is going to be all responsible for movement of the eye. So the next one is going to be trigeminal. I have a cheesy way of exercising this one. This is going to be sensation for the face, and it's also going to be responsible for muscles and mastication. So I have some gum here. We'll just do some gum, and that's a good exercise for your jaw. There's also some little jaw exercise things you can buy that you can chew on that'll help strengthen your jaw muscles. The next one we're going to jump into is facial nerve exercises, and this one I will also demonstrate later as well. The next one is vestibulocochlear. This is going to be responsible for hearing imbalances. And then there's also this thing called VORs. The best way I can describe that is like your hearing and light reflex. So that's going to be stimulated by, like, I like to call it, this is going to be silly, but the child's game, flinch. So you go up and try to hit somebody and then they flinch. That's going to be your VOR reflex, and this is going to be responsible for that. So there's really not a really great way of activating that other than just activating it. But that can help activate this system here and help you kind of maintain some help your vestibulocochlear system by activating that like whole reflex system. The next thing you could do also is just stand on something like one leg. I've got a yoga block here I'm standing on. Stand on one leg, and we're going to exercise balance. So practice your balance, and you'll be working on your cranial nerve 8. The next one is going to be glossopharyngeal, and this is going to kind of be done with facial nerve. But it's going to kind of help with swallowing. This is really going to be kind of the back of your throat, cranial nerve. The next one is going to be cranial nerve 9, vagus. It's going to be the wanderer. Or cranial nerve 10, vagus, the wanderer. This is really responsible for internal organs and a lot of parasympathetic innervation throughout the body. So honestly, this one doesn't really have a lot to do with a lot of things except for like maybe gag reflex and speech. So there's this technique called UJ breathing. I probably said that horribly, but it's called like the breath of fire. And imagine yourself breathing onto a glass trying to create fog. So then just close your mouth. It should sound like a roaring ocean. So, and this is a breathing technique that can kind of help relax you and stimulate your vagus nerve. The next one we're going to talk about is cranial nerve 11, which is your spinal accessory. This is going to be your sternocleidoid mastoid. This is going to be responsible for neck rotation and your upper trapezius, which is going to be like shrugging your shoulders like this. I'm also going to demonstrate these ones later as well. And the final cranial nerve is cranial nerve 12, which is going to be responsible for your tongue. And it's mostly tongue motor and some swallowing. So really, the best way to do this one is tongue exercises. So you just stick your tongue out, deviate to the side that's weaker. So you stick your tongue out first, figure out which side your tongue naturally deviates to. That side's your weaker side, and then that's the side you want to deviate your tongue towards to exercise. So you're going to deviate it. Let's say I got a weaker muscle to the right, deviate to the right, and then I'm just going to bring it back into my mouth. And you'll just do like 10 of those, and that'll exercise your hypoglossal nerve. So I do just want to add that none of this stuff is meant to be medical advice. This video is just really for informational purposes only. If you have any real issues with your cranial nerves, you really do need to see your doctor. But these might be ways of activating and exercising your cranial nerves. This is also not a treatment plan, so just keep that in mind as well. So this is really just kind of ways to exercise and stimulate the nerves. and really informational purposes only. So that's that for now, and now I will go ahead and demonstrate the facial muscles. Going to demonstrate some facial exercises. So if you're ever experiencing something like facial paralysis, or you just want to exercise your face, these are some ways to do that. So raise your eyebrows. Or if they can't move, you can actually help them with your fingers. But raise your eyebrows. You can only raise the one on that side. Depress your eyebrows like you're angry. You can also help your fingers. Help do that if you're having issues. Flare your nostrils. This one's kind of hard to do, but you'll flare out your nostrils. Some people flare down their nostrils. Whichever one, you can kind of help with your fingers as well. And then simply smile or frown. These will also help activate your facial muscles. So you just smile. Once again, you can help. Or frown. Once again, you can help. And then the final one you can do is this one here. I don't know how you would help activate this muscle, but kind of clenching your neck. This muscle is known as the platysma muscle, is also activated by your facial nerve. These are some kind of exercises to help get your facial nerve going. So just smile. You can also blow out your cheeks. And maybe help hold them out if you're having issues blowing out your cheeks. Those are some facial muscle exercises. The next one we're going to work on is the spinal accessory nerve. So this is cranial nerve 11. It's pretty easy to exercise. It's just called chin to the sky. You don't want a double chin, so you really want to try to extend out your neck, and you just raise your chin, and you hold it for as high as you can, for as long as you can. And it really works your sternocleidomastoid muscle, or SCM, as you can see. And if you want to get it harder, just try to raise your chin higher. Okay, and the next one we'll do, and I hope this is your trapezius, and you're just going to do pretty easy muscle up and down. And this will help work that. This also works some other rotator muscles, but really we just want to work on the upper traps for this. And that's that. How did that last? So the final thing we're going to demonstrate today is the Brock strings exam. This is Mr. Jenga Bones, and this is my mother. And then there's the dog and the cat fighting. The Brock string exam is really quite easy to do. All we're going to do is have the patient tie a string somewhere at eye level, or have a partner hold the string at eye level. Make sure the string is taut. Put the string at the patient's nose, and then the patient's going to simply look at each bead or point on the Brock string. The patient should see a string coming from each eye, and then a string leaving from each bead, forming an X pattern. This is representing the two fields of vision, and this is what the Brock string is demonstrating. This will exercise basically your eye muscles, and hopefully keeping them engaged. The Brock string will help the patient realize that they may be having like a lazy eye, or maybe one of the eyes not focusing in as much, if they notice that they're not seeing the X pattern. So if you just see one bead, that means one eye may be compensating for the other. So you may need to move the bead in closer for the patient, and then they can focus in on that a little bit easier. And this test is really easily rushed. Make sure you just take your time. This is about feedback and learning your patient's limitations. So making sure you give them good feedback. So look at their eyes and making sure they're staying converged on the target. It's very easy for the patient's eyes to wander and diverge. And that is the final exam we'll demonstrate today. Thank you.